Aphthous ulcer is a well-circumscribed lesion on the lips or tongue or other mucosal parts of the oral cavity, where you see a yellowish white center with a red halo around it. And that yellow color is a fibrin clot, a pseudomembrane-like thing which covers the defect in that area. You may be able to wipe it off a little bit, and sometimes it may come off with a little bit of bleeding. It can occur in any age, and most of 50% of people would have got it at some point of time. It has got a genetic predisposition. It is aggravated by stress. It can occur after trauma. It can occur in viral diseases like cytomegalovirus and Epstein-Barr viral infections. Streptococcus and H. pylori are bacteria which can cause the same thing. NSAIDs, non-steroidal anti-inflammatory drugs, can cause aggravation in ulcers. Spicy food can cause this, and actually iron deficiency, folic acid deficiency and vitamin B12 deficiencies can cause Aphthous ulcers. It is highly painful. It can cause burning sensation, it can cause irritation, it rarely causes itching sensation, and can have difficulty in having food, and that's what is most concerning to the parents. And when you look at it, you will see, as mentioned earlier, well circumscribed round lesion with redness around it and yellowish patch in the center, and it can occur in single or in multiple numbers, and sometimes in herpetiform lesions. In certain infections, you will see multiple numbers on the throat as small dots, but with similar shape. So it is a variety of Aphthous ulcer. So when you see this multiple times, usually it can occur that way, but we need to follow up the weight of the child, look at the hydration and nutritional status of the child, look for other lymph nodes and ulcers in other locations to rule out other diseases. Investigation wise, there is nothing much to do. If it's a chronic ulcer lasting for a very long period, you may be forced to do a biopsy and see, not in kids but in adults. In kids, rarely iron, folic acid and vitamin B12 levels may be checked to see the deficiency, and if needed, treat it. So usually single ulcers are the one which occur, and it can occur after trauma. It can occur as a standalone recurrent Aphthous ulcer. It can be in multiple numbers in bacterial infections and viral infections, and it can occur as a part of other systemic diseases as well. But most often, this is single isolated ulcer seen as a part of recurrent Aphthous ulcer, which is mostly a genetic thing. So how do you treat it? Treatment is basically ensuring hydration, ensuring nutrition. If it is highly painful, give paracetamol, antimicrobial mouthwash if you are suspecting an infection, and specific treatment. If you are suspecting bacterial infection, you can give antibiotics. If you are suspecting a viral infection, you can give antivirals. Rarely steroids will help. And if it's a deficiency, if you can prove there is a deficiency, then iron, zinc, folic acid and vitamin B12 supplementation will help in decreasing the symptoms. So all Aphthous ulcer are not due to deficiency, and just giving multivitamin will not cure that as well. If it is due to deficiency, it may get relieved with multivitamins. So Aphthous ulcer is a common thing. There is nothing to get worried about it. Next is geographic tongue. Geographic tongue is the whole tongue looks like a world map. It's otherwise called as benign migrating glossitis. It is very seen in around 1 to 2% of people, and there is a genetic predisposition again, and it's not due to multivitamin deficiency. It's a self-limiting disease. There's no treatment, no complication. It settles by itself, but the sight of it is a little bit scary because you'll see different sized patches on the tongue, but most of the time it's asymptomatic. Some kids find it difficult to have spicy food, that's all, but it resolves by itself. There is no treatment. Happy parenting.